If that's there you go. Recording in progress. Thank you. Welcome, everyone. Thank you for joining us today. Again, my name is Brenda Helget. I'm Executive Director of A Time to Heal Cancer Foundation. So I want to start off by thanking our title sponsor, Nebraska Cancer Specialists. They sponsor each of our Create Your Best Life events, including the session today. And so for more information, please visit their website at nebraskacancer.com. And I do want to say that normally we have continuing education available for these events, but unfortunately we weren't able to pull this together in time for our partners at Nebraska Methodist College to get the continuing education ready to go. So we apologize for that. But next month we are planning to, we will have that approved. It is, I think, approved already for CE. So stay tuned for that one. That's going to be a really, really great session as well. So let me introduce our speaker today, and I've already probably gonna mangle her name, Dr. Laura Bilek,
Yeah.
right?
Yes, you got it.
Yes. Dr. Laura Bilek received her professional physical therapy degree in 1988 and her PhD in medical sciences in 1994 from UNMC, University of Nebraska Medical Center. Dr. Bilek joined the faculty at the Division of Physical Therapy in the College of Allied Health Professions at UNMC in 1992. She continues to work there as currently the Linder Professor for Women's Health and the Associate Dean for Research in the college. In addition, she's chair of the Medical Science Graduate Program at UNMC. Dr. Bilek's research interest is in the role of exercise in prevention and management of chronic disease with a specific focus on exercise for bone health. Her research has been funded by the Arthritis Foundation and NIH. And this is really, I think, super exciting for all of us that are cancer survivors, myself included. We really want to know what we can do to help our bone health. And then for those of us like myself who are already starting to get arthritis, this is going to be kind of a just doubly great for all of us. So Dr. Bilek, thank you so much for joining us today. And we're so excited to hear your presentation.
Fantastic. Thank you. It's really my pleasure to be here today. And let me get my slides started and make sure. Okay, you seeing my slides now?
Yes.
Okay, wonderful. Well, I am passionate about bone health. We don't feel our bones when they're starting to get weak or we're at risk of fracture, so they're often neglected. So thank you very much for giving me the opportunity to visit with you today. And I'm going to start by identifying some disclosures. I am a clinical advisor for a company called Bone Health Technologies. I did some research for them on a medical device for bone health. I don't have that in my talk today. I have a subcontract with them, and as Brenda mentioned, I have had NIH funding for exercise trial, which I'm going to talk, where we look at what the outcomes are on bone relative to exercise. So I'm starting with some basic definitions, and I know some of you may know this, but I want to make sure that we're all on the same page when I'm using these words. Osteoporosis is when you have low bone density and you are at risk of fracture. So we've heard that, and but I want to identify that there's more than one way to be diagnosed with osteoporosis. If you have a DEXA scan and it says your bone density is in the range of osteoporosis, you could have a diagnosis that way. But we recently understand that if you have something called a fragility fracture, that means your bones have some impairment, and you should be considered to have osteoporosis and follow the guidelines for treatment. So what is a fragility fracture? It's a fracture where you fall. It's not high velocity like in a car accident or riding a bike and falling down. But if you fall in your home and you break your wrist, that shouldn't happen. If it does, it's considered a fragility fracture, and then you would likely be categorized or diagnosed as having osteoporosis. the stage before we progress to osteoporosis is called either low bone mass or osteopenia. So it's where you have some bone loss. You're not in the normal category, but you haven't crossed over into the diagnostic category of osteoporosis. How do you assess bone health? Um, I want to ask a question here. I'm not sure I can see everybody, but how many of you have had a DEXA scan? Okay, so most of you have had a DEXA scan. So this machine here looks familiar to you. Oops. I want to identify that this is very low radiation. It's a very, very safe way to assess our bones. A DEXA scan has about the same amount of radiation as being outside for a few hours. You lay on a bed like that, and the arm moves across your body and sends radiation uh, underneath and is captured in the underneath the bed to give an image of your bone. So how do we define our bone health? Our peak bone mass occurred at age 30. And if you have your bone density tested, they'll take the density of your hip and spine, and they will compare it to bone density of a person of the same sex and race at age 30. And that gives you a score, gives you a T-score. Oops, my computer is advancing when I don't want it to, so I apologize for that. If there is no difference between your bone density and the bone density of a 30-year-old, then you would have a T-score of 0. The minus numbers for T-scores show how many standard deviations your bone density is below reference 30-year-old. So if you have a bone density of -1, your density is 1 standard deviation below that of a 30-year-old. As you can see here, the T-scores have categories for the definitions we talked about before. If your T-score is between -1 and -2.5, you have osteopenia or low bone mass, again, early bone loss. When the T-score drops to -2.5, then we have a diagnosis of osteoporosis. And now I was going to ask you some questions. How often should cancer survivors get a DEXA scan? Ooh, that's a good question. I don't know specifically about cancer survivors. The general guidelines are that persons above age 65 should have a DEXA scan, and Medicare will pay for it every 2 years. The reason we wait 2 years is because bone loss is fairly slow, and you need about 2 years to see if there's been a change. However, we're going to talk a little bit later about increased bone loss with some cancer treatments. So I would talk to your physician or your survivorship provider and see if they recommend a DEXA scan any more frequently than every 2 years. So I was able to see, I'm going to ask you all now, I'm going to stop sharing. If you don't mind, how many of you know your T-score? A few. Okay. How many of you had a DEXA but aren't sure of your T-score? Okay, we have a few there too. I would encourage you, when we're done here, go back and look at where you're at in those guidelines. And regardless, the same recommendations hold true for exercise kind of throughout the range of T-scores. I'm going to go back to my questions. The next thing I'm going to ask is if you know your risk factors for osteoporosis and fracture. Looks like we have, okay. This is a list of modifiable, non-modifiable risk factors, as well as some things in our health that could cause osteoporosis. I'm going to talk about my daughters here because they have non-modifiable risk factors and secondary causes of osteoporosis. My daughter, Tara, in the tall one here, picking apples, she is very thin. She has a small frame. She's obviously white ethnicity and female. So she has high risk factors just because of her shape and who she is. My other two daughters also have similar risk factors as Tara, but my daughter, Anna, here has an autoimmune disease. So if you go down to the secondary causes of osteoporosis, her inflammatory disease increases the risk of osteoporosis. And when she was a child, she had to be on high dose corticosteroids for some time. And so use of corticosteroid medications does increase your risk. It's not as great when you're a young child because you can recover from that. But she has several other risk factors. So I'm always reminding her about her diet. But she has a very high level of physical activity and a very, very good diet. So she has some positives on the modifiable risk factors. Now, cancer treatments do affect bone. So I have a figure here, a table that I got from a manuscript that talks about factors that affect bone loss. These are obviously large words, and you may recognize them if it's a treatment that you had. But taking out the testes or the ovaries, either one can cause very significant changes in bone. For men who are on androgen deprivation therapy, ADT, for prostate cancer, that blocks hormones and it does have a negative effect on bone. And there are some specific chemotherapy agents that can affect bones, and that would be something you would talk to your doctor about. And some of the drugs that affect hormones and estrogen blockers affect bones. Probably many of you are on aromatase inhibitors, an amazing drug. It does great things, but they will monitor your bone health with that to make sure that you aren't losing too much bone. Just because these things are associated with negative consequences for bone, I'm in no way suggesting that they are not appropriate and great treatments. It just gives us an indication that we want to pay special attention to our bones. Radiation therapy can cause some effect on bones, and glucocorticoids. They can be used in very high doses for some cancers, and that would have an effect on bone. So why do we care about bone health and preventing bone loss? I want to back up a minute. Okay, we have a couple questions here. Does this present more? And it does. So I was told my bones wouldn't be the same. Okay, have you had a DEXA scan? There was one young man in here. I'm having a hard time seeing everyone's photos and my slides. So I want to just unmute and ask questions. Men's fracture risk is much lower than women. If you look back at the slide on risk factors, female gender was one. As far as chemotherapy and your bones not being the same, I would talk to your doctor about getting a DEXA. And when we're done with this section, I'm going to move on to some treatments and talk about the options that we have for treating our bones. But let's do a little background learning here. This is a perfect slide since we had male and female conversation. The blue line shows the change in bone in a man over a lifespan. The red line shows female bone over the lifespan. Both increase rapidly during the child and teenage years, peak at age 30, but men will have a larger bone mass. They'll have higher bone density and just bigger bones than women do. Then from age 30, men have a slow, steady decline in bone mass. Women uh, have a very rapid bone loss at menopause. Up to 2% of bone a year is lost at the peri or begin right before menopause and the first 5-6 years after menopause. We lose a lot of bone. Then we level off, and bone loss after age 60 is kind of slow and steady. So let me see. I think I have, there we go. I put this line in here to show you that this may be the threshold when your bones become weak enough that they would fracture. So for women and men, well, this is really a fracture threshold for women. You can see how you lost most of your bone during the postmenopausal years, but you don't cross that threshold till you're up in, in your older age, like in your 80s. But that curve is shifted for many cancer patients. This slide, I took it from this article, and I'm sorry it's a little blurry, but I'm going to walk you through it. This shows the percent of bone loss annually under different circumstances. So men typically only lose 0.5% of bone a year, say after age 30. So answers to that question. Women in late menopause. So again, probably above age 60, I can't find it here, right here, you lose about 1% a year. But as I mentioned just a moment ago, in early menopause, that's when we lose the bone most rapidly, and we lose 2% a year. Aromatase inhibitor therapy, you can lose a little bit more than that annually at 2.6%. And patients that have had bone marrow transplants, they have a greater loss at about 3.3%. But one thing that I think is often overlooked is androgen deprivation therapy for men. It blocks testosterone, and it affects bone health, and you can lose quite a bit of bone in the years that you're on ADT. There's other sorts of therapies that can cause even greater risk, but for women whose ovaries kind of are shut down or put into early menopause, that can cause great rates of loss of bone mass. This is specifically looking at the lumbar spine. That's why have a conversation with your oncologist or your primary care doctor to make sure that you are being evaluated. And it looks like we have some questions here. Oh, I forgot about immunotherapy. I don't know. And immunotherapy is newer, so I'm not sure how much monitoring has been done. I would obviously address bone health and have it assessed because we know other immunologic diseases that are high inflammation can cause bone loss. Does thyroid replacement drugs? It shouldn't. And if your thyroid replacement has your lab values within normal limits, it shouldn't affect your bone. If you're low thyroid and you're not getting replacement therapy, or your thyroid is too high and it's not regulated, that can affect bone health. But thyroid medications are fairly normal and should be safe. We have someone on Boniva, breast cancer, chemo, radiation. Boniva is a great drug. I'm going to move on to drugs very briefly. I want to be clear that I am an exercise researcher, but I am a big believer in the medications that we have for bone health. One like Boniva has been around for decades, and so we know its safety profile. We know it's safe. We know that if we treat someone for just 5 years, that decreases some risk of rare side effects. The other thing that's not in my scope of practice, but I do understand that Boniva and other drugs like it that are caused bisphosphonates may actually protect bone against metastasis or decreased metastasis. So it's not bad for cancer. It may be helpful for people with cancer. Okay, so we talked about how cancer in numerous ways, chemo, hormone blockers, radiation can affect our bones. You remember the slide I showed you before? I am trying to indicate with a hand-drawn red line here how cancer may make us more vulnerable to a fracture earlier. So we had this red line where we lost, again, this is for women, the same would hold true for men, where we lose a lot of bone in menopause. But say if you had cancer at 58, and based on the chemotherapy and the radiation you had, maybe you had even greater bone loss, more rapid bone loss, and then you flatten out once treatment's over. But you can see then, if this is the threshold for fracture, you're going to reach the threshold for fracture much earlier, at say 70 instead of 85. So that's why I think preventing bone loss or treating it when you have enough bone loss is really warranted. Why do we care about bone health? We all know hip fractures are bad, but the data about hip fractures and our independence and potentially death, it's a very devastating occurrence. So of people who have a hip fracture, between 1 in 4 and 1 in 5 die within the first year. No one really understands why, and it's not usually right away at the time of hip fracture, but your risk of death is high for the year after a hip fracture. So we should do everything we can to prevent hip fractures. But I am a physical therapist and I did home care for years and years. And losing your independence is very, that's heart-wrenching if you lose your independence at an early point in your life. So 40% may not be able to walk independently and may need a walker or something. And 60% may require assistance, like with their home, etc. And 1 in 3 may end up in a long-term care center. So this isn't to scare you, it's just to motivate us all that we're gonna work on our bones before we have a hip fracture. We're gonna see what we can do to prevent that. The other fracture that's very common, especially in women, is something we call a vertebral compression fracture. It's when one of the bones, usually in your chest, the vertebrae in your chest here, kind of collapses in the front area. If you think about persons who have used to call it a Dowager hump, these are the kind of fractures that might cause that. But aside from any change in shape of your spine, they're very, very painful and would limit a person's ability to care for themselves because any movement at all can be painful. So we want to prevent hip fractures. We also want to keep our spine healthy. And I see another question. If you're still in the normal range, oh my gosh, Terry, amen to you. No, I don't think that if you're in the normal range, there would be, your physician would likely not recommend any bone medications. Many of you might be in the osteopenia range, and many physicians will recommend some medications at that point to prevent additional bone loss. The guidelines say that absolutely once you've crossed over into osteoporosis, the medications are recommended. Again, in the early bone loss, low bone mass osteopenia, in some instances, physicians will recommend that. Say if you are in your 50s and you're in osteopenia, almost osteoporosis, that might be there might be an indication there. That's not my scope of practice. I don't prescribe medications. I just work with providers who do. And so that's my understanding of some of their decision making. So how do we prevent fractures? Oh my goodness, my slides overlapping here. Diet, dairy, probably already know that. Not going to talk about it. I put some there because of vitamin D. We need to have adequate vitamin D. We don't need to take high doses. We just need to have enough. And when most people are out in the sun in the summer, they have a normal vitamin D level. Here in Nebraska, normal is 30. And most people after they've had the summer to get vitamin D, if we'd measure in September, the average would be 30. If we wait 6 months and measure our vitamin D without any supplementation in February, it'd be about 21. So we would be low because we're not outside in the angle of the sun. In the winter months, you definitely would probably want to take some vitamin D and make sure you get enough in your diet. Smoking, as I mentioned, or think it was on the slide, can be detrimental to our health. And the other way we prevent fractures, some positive things are medications. The pill there is for me to remember to tell you that I am a believer in medications. I believe in a holistic approach to bone health that also would involve exercise. And the shoes there are for exercise. And then I have a little weightlifting person here because I'm going to talk about weightlifting, but it's all about the muscle. It's about making sure our muscles, we maintain the size of the muscles and we make the muscles work. That helps us to maintain strong bone health.
Dr. Bilek, I have a question as a survivor myself and
Yes,
in
yes.
that osteopenia category. I actually don't have any idea kind of what my baseline is for my vitamin D. Is it different from person to person? And should I know that? Should I try to get it tested once in the summer, once in the winter, so I kind of know what my normal is?
I actually had this conversation with, I think they were prostate cancer oncologists. It's expensive to run vitamin D, and we know that everyone's is going to drop in our area because we aren't getting as much sun. So I think that there's a standard recommendation for taking vitamin D year round. So I would talk to your provider about what they recommend. You might also be able to Google, make sure it's a good source of information about what vitamin D supplementation is recommended daily for cancer survivors.
And thank you for that. I do take a calcium supplement that has vitamin
Has
D
vitamin D.
every day, but I'm not a dairy person, not a milk drinker. I drink oat milk. So I worry about it all the time a little bit. Do I need a little bit more? Things like that.
Um, uh, for calcium, I don't have a slide for this, but if you go to the Osteoporosis Foundation, it used to be National Osteoporosis Foundation. Now I think it's the International Osteoporosis Foundation. There's something called a calcium calculator, and you put in the dairy that you eat each day, and it'll tell you how much calcium you're getting from your food.
Oh,
And then in our research studies, the endocrinologists that we worked with then had us prescribe calcium. They prescribed calcium for the women in my studies to make up the gap between the recommended daily allowance of calcium and what a woman is getting in their diet. So if you're getting 800 milligrams in your diet and the guidelines say 1200 milligrams, then we would have you supplement that amount. I'm going to encourage all of you to talk about calcium with your doctor, because there's a hint that taking a lot may negatively affect you. Everything in moderation. Just because we have know that vitamin D and calcium is good, taking excess is not necessary. It could be actually detrimental to your health. So make sure you're talking to providers and getting the range that is the recommended amount. Okay, let's go back to the slides. So I told you I had a little weightlifter there because we're going to talk about exercise. The next part is I'm going to talk about how you would exercise to maintain your lean mass or muscle and to help with bone health. So I think we have a few questions here before we get into the exercise part. Oh, what medical specialization treats bone health? It's my understanding that many primary care providers may prescribe bone medications, and they frequently are the ones that would order a DEXA scan. However, if there's some concern about your bones, the person who is a specialist in bone health is an endocrinologist. And if you are on a med for metastatic cancer and bone is already being treated, I do not know those two drugs, and I would absolutely just organize with your physician if you need anything else. So it sounds like you're Joan, that you have everything under control with those medications to help maintain your bone. Any other questions before I go on to talk about specific exercises?
I'm just going to preface your bone impact exercises because I know everyone will be thinking the same thing. Dr. Bilek, you're going to go into sometimes some of us get a lot, we look at, oh God, jumping rope and lunges and think,
Oh, I have another slide where I say don't do that. So I'm going to talk about it. And these are the recommended exercises that help maintain bone health. And all the scientific literature says you should do two things. You should have lower impact through your legs, like a hard impact, as well as weightlifting. So these are examples that I would use when I would prescribe exercise to anyone who's trying to increase their bone health. But again, jumping rope and calisthenics are not ones that I would recommend. So I want to talk about ones that are easy to do on your own. Now, lunges are a good exercise if you can see that picture of my colleague who's the demo, but they're hard to do accurately and safely. The same with jumping rope and calisthenics. You can injure yourself if you land incorrectly. So the bottom row here is things that are easy to do and safe to do for most people. I said, the recommendations say lower extremity impact. I think that the effect we're having on our bones is that we're doing an exercise that uses the muscles around our hips. So if we're trying to find a lower extremity exercise that uses the muscles around our hip, we're going to do things where we're going up and down hills and up and down stairs. That's pretty accessible to most. And I was going to talk about this when we get into osteoporosis, but see here on the stairs, there's a railing there for safety. So if you are not quite strong enough to get up and down the height of a stair, you can use the railing to help you. And also, this is me hiking. I mentioned that I had my dogs. What I do, I'm gonna pivot here. This is what I do for my bone health. I take a walk most mornings whenever I can. I live out in the country, and I literally head from one hill to another hill. So my walk is not on flat. I'm going up and down hills, which gives a lot more exercises to the muscles around my hip. And it's also getting my heart rate up. So I'm doing some exercise for my fitness also. So I'm killing two birds with one stone. And I have a walking stick there. I don't really need it to go up and down the hills where I live in rural Iowa, but I do it because you never know if you're going to run into an animal or a snake, and I'm afraid of snakes. So I always carry my walking stick, but it's also very good if you're on a hill that's pretty difficult. You just use a walking stick, and you can use one in each hand that helps you. Also, I don't have slides about this, but after chemotherapy, some people, the nerves in the lower part of their legs and their feet may not be what they used to be, and that can make you at higher risk of falls. So again, that would really lead us over to the bottom two pictures here, where you would be doing some stair climbing, maybe with a railing, Or if you're walking outside on hills, that you would definitely want at least one, maybe two walking sticks. The more pegs you have on the ground, the better your balance is going to be. I love those because the walking sticks actually are retractable. So you can shorten them up to where they're about a foot and a half long and they can go with you anywhere. And for younger people who want to do classes, and some of these exercises may be okay. I have one question. Oh, Live Strong. Live Strong is amazing. We have a group of cancer survivor researchers that work together to create studies to improve the health of survivors. And we are partnering with the director, Amy Rue, of the Live Strong program. It is amazing. And I'm going to go on to the next slide because when we talk about weight training here, for bone health for young people, doing what we call free weights like this can have a bigger impact on bones. I absolutely do not recommend that for really anyone over 40, because if you're doing weightlifting with a machine, you can see how the machine will control your body and your position to make it safer. What if she twisted there a little bit and that weight kind of slipped off her back? It would cause an injury. So I'm always recommending machines. And at Livestrong, they can make sure that you're using correct technique and help you build up an exercise program with the machines. It is an absolutely amazing program.
And Dr. Bilek, I'm going to jump in since we do have folks that are from out of state and across the country.
Okay.
The Live Strong program is available nationally through the YMCA's. We are very, very fortunate here in the Omaha area, and I think throughout Nebraska, that the Live Strong program is completely free. And in addition to that, the Live Strong program here in Omaha, you will also get a free membership during the time that you're taking the Live Strong program. So there's absolutely no financial barriers for you to go ahead and do that. And I think it is the same in a lot of different states. So check in your state to see if not only you can take the Live Strong program for free, but also get a free membership.
I think you're right about the Livestrong program nationally offering free membership. Um, and I'm not going to go through all the machines that you should do for bone health, but all the major muscle groups of your body. And you would want someone to teach you how to use the machines instead of just joining the Y or a fitness center. You want to make sure you're using the machines correctly. Okay, a couple more comments. Your family can use the Y free. Okay, that's fantastic. Above and Beyond Cancer in Iowa. I don't know that one. I'm gonna have to look that up. I don't think I
I
have a pen.
They are great partners of ours, Dr. Bilek, Above and
Okay.
Beyond Cancer in Des Moines, Iowa, and they are another wonderful resource. And if I can add one more thing, and when we're talking about weights, I'm very curious. So I notice you do say resistance training. So I don't want anybody to be frightened off and think you have to lift a lot of weight to get results, right?
Well, you do for bone health. I'm going to go through that, but I'm going to talk about when you lighten the weight so you don't have a risk. So first of all, this slide just represents what I talked about. You can see you need to have good posture. Here we have a person doing a lunge, my coordinator Mel, and then I'm showing how to do it wrong. So you want to do the exercises right. I'm going to talk about, oh, sorry, I have one more slide. This is important when we talk about specific exercises. You can see I'm picking up a weight using very good body mechanics here. My back is straight and I'm using my legs. It's really easy to just bend over at the waist and hips and pick something up off the floor. But when I bend forward, especially when I'm twisting, that's a motion that's puts great force on your spine and is where you might end up getting a compression fracture. So this is why one of the reasons I don't recommend free weights is because just picking them up and putting them down can be risky. But also think about the activities that you do where you might be moving that way. I am a gardener, love to garden, but I have a pad that I kneel on so when I can get down low to the ground to do my work so I'm not bending all the way over from above. Getting things out of the dryer, we bend over and use this type of motion frequently. But if you could squat down and reach in, that's much safer for your spine. And I don't have any idea of how we're doing on time. I am sorry about that. Does anyone else have the time up?
Yes, it's 10:43.
Oh, okay. Um, okay, so this is the part where Brenda just asked about how much weight you lift. For those of you who might be exercise trainers, the weight you would lift is 70% of what we call a one repetition max, or the weight you can only lift one time. But we have found that in geriatric exercise research and with most research that doing heavier weights results in better function. And it's not risky if you're doing the movement correctly. But to increase our muscle strength and have an effect on our bones, we want to lift a weight that we can only lift 8 to 12 times before we have what's called volitional fatigue. That means that I'm lifting a weight and I just can't lift it anymore. My muscles are too tired, or I lift it and I'm twisting or cheating or throwing it up. You want to do the exercises correctly, safely, and you should only be able to lift it 8 to 12 times before your body gets tired. That should not cause injury as long as you're using good body mechanics, keeping your body up straight. And you don't do that the first day you go to the gym. In a study I did on bone health, we took 4 to 6 weeks of 2 to 3 sessions per week to build up to a weight that was that heavy. If you build up sooner is when you might have soreness or have an injury. So I do encourage you to slowly build up weight as you're weightlifting to see if you can lift a weight that is that heavy. Now, what do I mean by sets? That means that I'm going to do weights and then oh my gosh, I can only do 10. Then I'm going to rest a minute and I'm going to do another set. The most benefit comes from the very first set, about 75%, then maybe another 15% with your second set. And it's the land of diminishing returns. So say you don't have a lot of time and you can only do one set of each of your exercises, you're still going to have some benefit. But I would say 2 sets is probably enough to really have a good effect. And the goal is 3 times a week, but I would say most people with busy lifestyles end up doing it 2 days a week. You can still have a positive effect. Okay, question. I do not know if Live Strong is in other gyms other than the YMCA. That's a good question.
I'm not sure about that either, and I'm
Mhm.
not sure if maybe they even have some videos available for folks that they could go off of. And Dr. Bilek, I'm not sure if you're familiar with the Les Mills program. They have one called Body Pump, which is lower weight, more, higher repetition. And
Mm-hmm.
they're very, very good about teaching you proper form and being safe. And that's something I've used at home in the past that I thought was pretty beneficial when you don't have a trainer,
Mm-hmm.
don't have somebody nearby, but they have a whole video on from all different angles on how you should look. It also helps to have a mirror so you
Mm-hmm.
can check your form in the mirror, I think.
Yeah, I can't recommend that. I'm not familiar with it. Some of the videos also have you doing things like crunches, which I wouldn't recommend. So, and any time you're exercising or lifting weights, it's positive. It's just that we know for that the higher weight is going to have a better effect, a greater effect on bone. But if your T score is worsening, you need to lower the resistance. So when I talked about volitional fatigue at 8 to 12 reps. For women with osteopenia, you should be able to tolerate that without any risk of fracture as long as you're maintaining an upright posture and doing the exercises correctly and slowly increasing the weight. But say if you have a T-score of minus 3.5 or 4, and you kind of have severe osteoporosis, you would want to lower the weight, and you would absolutely avoid anything where you're bending forward because your spine would be at risk for fracture. Also, avoid anything where you're standing and doing weights because you want to avoid falls too. Couple more questions here. Oh, sore. Oh, okay. Well, if your treatment was 2 years ago, um, boy, I can see that. I would recommend that you would talk to a physical therapist because there's multiple things that might be happening there, even some adhesions, maybe to the muscle, which isn't necessarily a problem except for the pain with the exercise. And so if you would work with a physical therapist, the other thing you could do if you're doing weightlifting is maybe if it hurts, don't do it. So maybe you're doing a chest press, but you can't reach the very end, or you're pushing overhead and you're just doing a smaller range of motion and not going all the way to the top. So yeah, if you have a physical therapist, I would recommend that you talk to them about that. And again, if it hurts, don't do it. That means you're pulling on something, you're irritating something, and you shouldn't do it. Yes. So again, exercise intensity. If you're going to the Live Strong program, or even if you're watching some of these videos, I would definitely know your T-score and talk with your trainer about that and let them know kind of what your category is. Live Strong is designed to be, I think, increase muscle strength for function. I don't know the specific protocol to know if it does the heavier weightlifting for bone health. And it doesn't mean that other weightlifting isn't also good to improve function. I've mentioned over and over again risk of vertebral compression fractures if you have osteoporosis, and even if you have osteopenia. You want to do nothing that has you bend over. Doing any exercise to improve your muscle function or balance is good for fall risk. And you might want to focus on some exercises that help you with your posture to sit upright. Some of you may have an inflammatory disease or arthritis, and so you want to adjust those exercises. Maybe you have a grip that's bigger because your hands are affected, but your range of motion may be limited. So again, just lift the weights in the range of motion that you are comfortable and do nothing that causes pain. I don't think I had this in my picture, but I want to mention, in addition to these, I would not do crunches for your abs. You can do planks or other exercises that can strengthen the muscles of your core around your middle. And again, we're back down to the hiking and stair climbing being the safest really for a person with osteoporosis. You don't want to do anything where you're landing hard. For the women who said they had normal bone density and you do like to do things like jumping rope, that should be safe. I have some pictures here for a person with osteoporosis. Well, for everybody, exercises that work on the muscles between your shoulder blades and along your back to, again, help you with posture. So we do have very small free weights, but see the example here where I'm laying on that rubber ball? That kind of supports my trunk a little bit so that I'm not as likely to, again, flex my spine when I lift up a weight to cause a fracture. And here I'm on all fours, so I'm bearing weight through one arm and I'm lifting another arm up. You have to have very strong core so that your body stays straight while you do that. That would be one that I might not recommend doing on your own.
Dr. Bilek, can you also talk about the Engage Wellness program over at UNMC? I assume you're familiar with that.
Well, I know they have a fitness center there, but
Mhm.
I don't know if they have any specific programs with weightlifting. I do know they have very qualified personnel over there that can help you begin an exercise program safely, but I'm not familiar with any specific programs or classes that they have. But again, they're very well educated trainers there. Um,
Yeah.
and so if I would definitely reach out to them if you're interested in finding a fitness center and you live in near UNMC.
And they do have an evidence-based, research-based program to reduce the risk of falling.
Oh,
And so that might be a great one for those of us a
yes.
little older and find ourselves kind of pitching forward more and more, and it really helps kind of retrain your body. And that might give you a jumping off point to do more exercises. Dr. Bilek talked about they're so important through your shoulders and your back.
And thank you. And I mentioned several times in there that exercise can and assist in maintaining or improving your balance. So that, especially if you feel that you have a balance problem or you and your doctor have identified it, you may want to start with the balance exercise program for safety reasons, because preventing falls is our number one priority. And then doing some weightlifting for muscle and bone would be layered on top of that. Mhm. And we only have a few minutes left. So wait, I have another question here. Oh, the strap exercises. They're safe if they're done with your body in being very straight. And the thing about most exercises is you want to not do more exercise than what your muscles can manage. So there's not a one size fits all. So the strap up exercises probably aren't going to be for a lot of the folks we have. They work better for someone who has been exercising and has a really strong core or the muscles in your back and your abs. Um, but with a good trainer, those can be helpful. Another question. Oh, yoga. Gosh, I yoga is a great exercise. I do not remember if it showed that there was a actual change in bone density, but certainly those movements are very healthy and very good for you. There was some studies that have shown Tai Chi can actually improve bone health, and Tai Chi also improves balance. I used to know where the Tai Chi um, programs were in Omaha, and I don't right now. But again, if you have a Tai Chi available to you and a good instructor, that's a great option.
I encourage everyone to look at A Time to Heal's website. And if you look under resources and then exercise, we do have some videos available. And I want to say Tai Chi is one of them. I do know Wings of Hope has some wonderful yoga classes that they do not only in person but online. So there's a lot of resources out there available. And Dr. Bilek, I know we're getting to the end here, but we still have time for more questions, folks. So please put them in the chat or raise your hand. But I have a question for you. Is there a book that you maybe could recommend? And there's a reason why I'm going to ask this question. We have a wonderful resource called Lisa's Library here at A Time to Heal. And thanks to the generosity of a wonderful person, she left us an estate gift. And we have filled this library with recommended books that are available for free to folks in the Omaha area. However, Dr. Bielik, if there is a book that you recommend, what I will do is offer this to anyone who is registered today, whether you're in Nebraska or not, I don't care where you are. If you have a book you can recommend, we will send that out free to anyone that wants that book. And maybe there's something about, like good form when you're lifting weights or something like that. You could, maybe it's even just a brochure. I don't know.
I don't know of any textbooks. I can look. I usually give people links to existing websites. The International Osteoporosis Foundation will go through some of this here with me. Um, I think there's a place in Canada that has a good website too. I'll try to pull those up and get back to you so
Well,
you can share
yeah,
those.
why don't you send them to us and we'll send them out to everybody that registered in a follow-up email and we'll make sure everyone gets those. Thank
Yeah.
you. Does anybody else have any questions for Dr. Bilek before we go on with our beautiful Saturday, at least here in Omaha? I hope it's beautiful wherever you're at right now. And what does TRX mean? It said TRX strap exercises, so I was curious what
I
that
don't
meant.
know what it stands for. There's just exercise straps where you put your feet in these straps and you like rest your so your legs are kind of off the ground and your hands or arms might be on the ground in different positions to strengthen all the muscles around your
Yeah.
arms and your hips and your
And
torso.
and what about a reformer that folks use? Is a reformer machine a good one?
I have no idea what a reformer is.
It's those machines that folks use for yoga and for strength Pilates. Is that right, Tam?
Oh, I think Pilates is good, but I'm always cautious in making recommendations because it's about the position that you're in and making sure that you're not doing anything that could cause injury. Um, so I think Pilates is an exercise that would be recommended, but I would start with if you have access to a gym or someone who could train you. Um, I'm always hesitant to have someone start exercise on their own, especially if they have osteoporosis. So
It looks like Terry has a question here, and she said test results show lumbar and left hip scores. Which do I look at for my T score?
if you have your DEXA scan, it will give you a density measure that's grams per centimeter squared, I believe. A T score is probably is a column that has a T score listed. Um, the if it's a density, it's going to be something like 0.7 something. And a T score is going to be a right around zero with negative numbers, like I showed you.
And Cindy has one more question. She said, this is such timely info. I just had my first DEXA scan last week. I have osteopenia, so I'm going to do everything I can to not have further bone loss while I take letrozole. Thank you.
You know, I have osteopenia too. So I work very hard to get my exercise in to try to prevent bone loss and slow that curve. Um, it's helpful at any point in time, but I want to get the word out to women who have osteopenia to start exercising so maybe they can slow that curve and delay progression to osteoporosis.
I have one more question. Do you have any, is there any slides anywhere that show the difference on a chart if you do exercise versus someone that doesn't do exercise and kind of slowing that rate of osteoporosis?
I have one of those slides, but I did not include it in my presentation for today. I'll tell you, not to discourage you, but where you get the most bang for your buck is during childhood. Kids on the playground. They're going to build a much greater bone density and have a higher bone density of 30 at age 30. So you have more to lose. So really, for your kids and grandkids, having them have adequate calcium and being active all the time, that's the best prevention we have for fracture later in life. When we start to exercise, in our 20s and 30s, it does have an effect, but it's smaller. And we can slow the curve from older individuals for bone loss, but we aren't going to build bone. I do want to share one more thing for those of you that want to hang on for a moment. Um, Let me see if I can find this
While you're
slide.
looking for that, I will, Dr. Bielek, us folks with cancer, by gosh, give us an extra even 2%, 5%, we'll take it. You know what I mean? If we can help our bodies in any way, even if it's slight, I certainly just like someone else was saying, I'm going to do everything I can not to have hopefully further, like Cindy said, further bone loss or things like that. And we can all only do what we can do. And I think it's again important to remember, don't hurt yourself. Use a walking stick. Gosh, we have a walking trail out back here, and it's pretty darn hilly. And I had actually a hip replacement surgery a couple years ago, and it's funny how you don't notice that until you have something like that going on. And I thought, boy, I need a walking stick, and I was not ashamed at all. I had a purple cane, and I was proud of it. And I use mine, and other folks out on the walking trail do too, just so you don't feel like you're gonna fall. So that's always super important, and also to be safe during the winter, right? And make sure that if it's icy or snowy out, that you're being safe. So, and where did Dr. Bilek go? Now she's not on my list here. Uh-oh. I hope something. Oh, here, I have to let her back in. There we go. You're back. Uh, Dr. Bilek, sorry about that. I didn't notice that you had dropped out. We have one more question as well. Christine says they don't measure height at the doctor's office anymore. Just ask them to. One appointment I had elsewhere measured and height was about an inch shorter. How would a person address this with the GP? By the way, I have to jump in. I was saying I had a hip replacement surgery 2 years ago. I lost an inch because of because the hip was pitching me forward. I couldn't straighten all the way up, and then I got it replaced, and I was back. I got the inch back.
Good for you. Loss of height is a symptom, um, a sign potentially of poor bone health. So it might be an indication that you have some of those small vertebral compression fractures. So ask them to measure your height. But even if they're doing that, if you're a cancer survivor, my guess is that they're already doing DEXAs every 2 years, which will give more detailed information about your bones. So if you haven't had a DEXA, go get a DEXA to start with, monitor your height, and get DEXAs every year or two. I want to share something else in my exercise study found about how exercise affects bones. So if you'll give me just a moment to share my screen, we'll see if this works this time. Okay, so I mentioned that I think the exercise slows the loss of bone density. But in a research study we did, we found that exercise actually affects the shape of a bone. What happens as we age is this is a young bone. You can see how thick what we call the cortical bone is. Think about the long bone in your shin or your upper leg. It thins out on the inside. So bone kind of goes away on the inside, so it's thinner. But as we get older, our body will actually lay down just a little bone on the outside so that the tube essentially gets a little bit bigger. It's very small. But think about breaking a twig. And a twig that's just a little bit bigger is harder to break. So the physics of the geometry is such that we believe that exercise adds a little bit of bone around the outside to make the bones just a little bit bigger. So we're not necessarily changing the density, but we might be doing things that aren't picked up on a DEXA scan. So the reason I'm telling you this is you might not see a lot of change in your DEXA scan. And if you're going to lose bone and you're slowing the bone loss, how do you have any feedback for that? You're not going to get any feedback that tells you your body is trying to make this adjustment to make your bones just a little bit bigger around to change your fracture risk. So, but we do know that exercise decreases fracture risk. So if you look at this slide, this is not necessarily cancer survivors, it's just all comers. And if we start following people at year 0 and we follow them for 13 years, if you look at the y-axis, this is the risk of hip fracture. Ooh, sorry, not in the right presentation mode. The persons who had very low activity, had a much higher risk of having a hip fracture. By year 13, 12%. At a 12% risk of having hip fracture. But those that were even moderately active, as well as high activity, had less than half the risk of hip fracture.
But how are you measuring low, moderate, and high?
Don't remember exactly what would be in there. I don't remember exactly what they said. My guess is that they used like moderate and high activity would be in the top 50 percentile of activity. It's going to be different for your age too. So let's talk about physical activity if you guys want to for a moment. The guidelines for health for everyone, just general guidelines, suggest getting 150 minutes of moderate activity a week. What is moderate activity? It's when we're exercising or walking and we feel like our breath is, we're a little short of breath, but we could have a conversation if we wanted to, okay? It's not just sauntering down the road, it's getting your heart rate up a little bit. The other way to look at it, if anyone's heard of the Borg scale, if not, you should feel like you're working fairly hard. It's a subjective feeling, but you want to feel like you're working fairly hard. 150 minutes is something that would be added for the whole week. So maybe you have 5 days where you walk for half an hour and you're feeling a little short of breath. Maybe you do 2 20-minute walks or 2 10-minute or 12-minute walks every day at that level, 7 days a week. There's lots of different ways to get that activity. For some people that don't take walks or are not active, the other thing you could do is just look at how many steps you take a day. Your phone will give you that information. The guidelines say 10,000 steps, but don't let that be daunting. Look at what your average steps are right now, and then just slowly increase those. So say if you're getting 4,000 steps a day right now, keep your eye on your phone, or if you have a Fitbit, say, okay, next week I'm going to try for 4,500 steps. I'm going to do that for a couple weeks till I feel like I got it. Then I'm going to move up to 5,000 steps a day. So just slowly increase and use something that's easily accessible like a phone or a Fitbit to tell you that. Any exercise is good exercise. And many of us are not going to be interested in weightlifting or going up and down stairs. But as that last figure I showed you says, being active is good, decreases risk of fractures, and improves your health overall.
One of my favorite tips for getting more steps into your day in a way that feels very painless is every time you talk on the phone, you walk. You just walk around your living room. It's going to feel like you're pacing. But what's so interesting is, I don't know about you, but I talk with my bestie. We'll talk for an hour on the phone.
I
But
do
it's
not talk on the phone anymore, so I would have to do it while I text, and then
Yeah, but if you just walk around while you're talking, it's almost like you don't even realize it's happening. And next thing you know, you look down, you think, "Oh wow, I've got a whole bunch more steps in." So that's just a little tip from me to you. Every time you talk on the phone, get up and walk around till the conversation is over. And you'll be surprised at how those extra steps might start adding up.
I mentioned my routine is I try to take my dogs for a walk in the morning. And I do that because my dogs love me when I take them for a walk. So that's a motivator for me. when my work allows me to do it, and I have to wait till the sun comes up. I want to tell you about my mom and dad. They're 85 and 86. And for years, I'm like, you guys should walk, maybe get some exercise in. And, I got the roll of the eyes. But during COVID, we were all so isolated. My mom and my dad got in their car every day and they drove somewhere different, sometimes, 45 minutes away. So they got out of the house and that's their socialization. They get out and they go somewhere and take a walk and they have their little routes. Some of you may like that. And my mom and dad have been doing that now since COVID. So for 4 years. And she gets in, like, she'll walk 5,000 steps during her exercise, which was unheard of. She couldn't even hardly make it up the stairs before COVID because of some of her issues. And so it also helps their mental health because they're getting out of the house. My dad is a rollator walker. He takes that and he maybe goes a quarter of a mile and he rests in a quarter mile back. That is a lot for him. So you're going to make choices where you're at today, what fits in with your lifestyle, your health, and your ability. I try to lift weights, but my job is very busy. I have 7, 8 hours of meetings a day, so I struggle to get my weightlifting in. So we're all challenged with this, but I'll give you a hint. Make a goal, a very specific goal. It says what you're going to do, how many times you're going to do it. And then I want you to think about how optimistic you are or confident that you can reach that goal. A scale of 1 to 10, 10 being I'm 100% sure that I can reach that goal. If your confidence is below 7, you need to set a goal that's not so ambitious. So for me, lifting weights 2 times a week, every week, my confidence is 4. So my goal is really, okay, if I can at least get there 1 time a week to lift weights or even 2 times a month, something is better than nothing. But I am very clear on when I think about it, I know what I'm optimistic that I can do and what I can't do. And after a presentation like this, sometimes you'll set these lofty goals that says, I'm going to go to the YMCA 6 times a week. Make sure you're confident it's something that is that you can do. Target that. So
Exactly. Well, Dr. Bilek, in this season of Thanksgiving, we're so grateful that you have been here with us today and sharing this wonderful information. The other thing I will tell you to help motivate you is also go to gratitude and say, I can take a walk because there's a lot of people that can't, or I can lift weights. And maybe it's not, I'm going to lift weights. Yeah, like you said, 5 times, like, I can lift weights today.
mm-hmm.
I can do that. Because
Mm-hmm.
there's a lot of folks that can't. But we are so grateful, Dr. Bilek. We're so grateful to you. We're so grateful to all of you that attended today. We're always here for you at A Time to Heal. If you ever need anything, look at our resource page. We have a lot of resources, again, from videos to book recommendations to websites on exercise, nutrition, financial resources, lots and lots of things, not only just here in the Omaha area, but across the nation. So take advantage of that. Oh, I like this. Priscilla says, thank you. Planet Fitness has a lot of gray-haired weightlifters. We love that. So,
And I will get you links to those websites that I think have very reliable information about starting an exercise program.
excellent. Well, thank you all. Have a great rest of your Saturday. Again, thank you so much, Dr. Bilek, and we will see you next month.
Thank you for the invitation. It was my